Welcome, everyone. Today we are chatting with Kenise of Nationwide Children's Hospital and Alicia from Children's Hospital of Los Angeles about a craniofacial specific psychosocial assessment tool that can be used by craniofacial teams to identify children and families who are experiencing challenges that may require referrals for psychosocial support or help assessing resources. My name is Khadijah Moten. I am the Outreach Director of Children's Craniofacial Association. So thank you, Kenise and Alicia, for joining us. And I understand that currently the tool has already been in use and more recently has been translated into a Spanish instrument as well. Could the two of you please start us off by telling us a little bit about your backgrounds and a little bit more about the assessment tool and how it works?
Sure. Thank you so much. Thanks for having us. We're excited to be here to talk more about this project. I am a clinical psychologist by training, and for the past 18 years, I have served as a psychologist on cleft and craniofacial teams, first at the Children's Hospital of Philadelphia, and over the past decade at Nationwide Children's Hospital, which is based in Columbus, Ohio. Several years ago, we kind of recognized the need that sometimes patients and families have specific issues that would benefit from having a conversation with either the team psychologist or the team social worker. But oftentimes their visits are very busy, and we don't always do a good job of identifying when patients and families could benefit from talking with one of us. And so we were looking for a way to better match when patients and families had that need and our availability to actually see them on the day when they're in clinic. So this psychosocial assessment tool was developed, and we tailored it to be sensitive to the kinds of stressors and challenges that patients and families with cleft or other craniofacial conditions may have. So things like teasing and bullying, or concerns about their appearance, or getting questions from other people about their appearance, issues around speech or learning, and then also just more general mental health kinds of questions or concerns as well, like things like anxiety or depression. So we began to integrate that instrument into our team's practice. And unfortunately, the measure exists right now in English, and we wanted to expand its reach so that families that speak Spanish as their first language could potentially benefit from filling that out and connecting with their cleft or craniofacial team.
And I'm Alessia Johns, and I'm a pediatric psychologist at Children's Hospital Los Angeles. And I've been partnering with Kenise in getting the Spanish version out, because we have a large Spanish-speaking population here in LA, as well as in many other parts of the country. And we're really excited to be able to have such a comprehensive tool available for teams, because it covers all of the different areas that Kenise talked about, as well as if there are needs in terms of housing or are there financial stressors in addition to what's going on emotionally. So it's a very comprehensive measure that can be used very efficiently. And if we have it in Spanish, it can be something that really helps with access to care for Spanish-speaking families.
Okay, awesome. Thank you. And what are some common things that the assessment tool looks for, or like what are the common questions that it asks to help?
So that's a great, happy to provide some introduction there for the measure itself. It is really pretty comprehensive, and it really thinks about not just the concerns for the child, but also for the family. So it asks about whether the child is experiencing any issues related to their mood, or any behavior concerns, like having difficulties getting along with family members or peers. It'll ask about how things are going at school. But then it also broadens the scope a bit and asks about how the parents are doing, like if they're experiencing any mental health challenges, have there been other stressors in the family, like job loss or death. We also there are also some items that ask about how siblings are doing. So if a sibling is struggling with mood or anxiety concerns, or if the sibling is being teased or bullied, we get some of that information as well, so that we have kind of a snapshot of how the family is doing, and we can think about the child in the context of their family and whether resources are needed.
Okay, awesome. And so is this a physical tool or is it kind of like an online assessment?
Yeah, so that's a great question. Currently, we administer the instrument in clinic using a paper and pencil version. So we just ask families to fill it out at the beginning of their visit. It can be integrated into the electronic medical record. Like, so some hospitals have it actually built into their system so that families could potentially fill it out online. But right now we're just using it in a paper and pencil version.
Okay, that's helpful.
And I should add, though, for families that may participate in the study, they would fill it out online following a link provided, and that would be something they can do very quickly just with a link that we'll have at the end of the video.
Exactly, okay. Yes.
Got it. Perfect. Thank you for the clarification. And now I know both of you had mentioned early on kind of a part of the why behind this project, but could you guys possibly expand on that? What is the purpose? What gap are we identifying by doing this assessment?
Sure. So I think there are a couple of gaps. One is that we want to make sure that families and their healthcare providers have a good way of kind of communicating what's happening, particularly around areas of concern. So this tool effectively gives patients or actually their caregivers a way to alert the team to specific needs. And that way those needs could be prioritized when they come in for a visit with their cleft or craniofacial team. So I think that's important. And I think the Spanish version in particular really addresses an issue of equity. Right now, we only have the measure available in English, and we want to make sure that all patients are able to access this tool and the resources that potentially could be available to them if their team was aware that they were having a concern. So in order to increase that equity, we want to make sure that it's available in Spanish. And I'll just add that Spanish is kind of step number one. We know that there are many other patients who speak different languages. So we want to, this is sort of step number two in a long line of potential versions of the psychosocial assessment tool. We'd like to see it in other languages eventually as well.
And then what does the future look like specifically for the Spanish instrument? Is it going to be anything different from the English one, or is it pretty much the same thing, just in Spanish?
Yeah, so we have translated it into Spanish, and an important next step, and this is where kind of the research piece comes in, is that we need to make sure that it is working in the same way that the English version works. So to that end, we want to make sure that the language is, that things have been translated appropriately, that families are understanding it, that the measure also, that it relates to other measures that have been established and tested in Spanish previously. So as part of the study, we're asking Spanish-speaking caregivers of children with any type of cleft or craniofacial condition to fill out the Spanish version of this assessment tool, along with some other established measures, meaning measures that have been in existence for a while, just so that we can see how those measures relate to each other. And that will help us make sure that this is a good measure that we can use reliably in clinic to identify families that are having risks in different areas.
Awesome. And then I know you guys have touched on kind of this research portion as well. So if someone is wanting to be involved in the research portion for this Spanish speaking portion, how would they get involved? And then is that also for families specifically that dominantly speak in Spanish, or could it also be that their dominant language is English, but they also speak in Spanish?
Yeah, great questions. So we will provide you with a link that you can share. So families that are interested in participating can click on that link and they'll be directed to the survey. There's an information sheet that describes the study and what they'll be asked to do. We make a priority of keeping the information confidential or private so that it's a secure survey that they're completing. And then they only have to complete the survey once. And it takes about anywhere from 30 to 60 minutes, depending on how fast they read and answer the items.
Families who are bilingual are welcome to participate as well.
Yes. Thank you so much, Alessia. The survey itself is and the consent is all in Spanish. So we are seeking families who can read and answer the items in Spanish. So whether Spanish is their first language or whether they're bilingual, they're welcome to participate. But the survey will be completed in Spanish.
Perfect. Well, that's all the questions I had on my end. Is there anything that either of you would like to add that I might have missed?
Just that we are incredibly grateful for the families being willing to participate in this, and that we hope that we can take the time that they invest in it to make it a worthwhile measure and to address these equity issues that Kenise outlined. The other thing I'll add quickly is that they will get, if they would like to, they'll get a payment of $20 in a Clin card, like a gift card that's mailed to them for thanking them for their time.
Yes, important. Yes.
Awesome. Well, I appreciate both of you sharing your time with us today. And we encourage anyone that's watching that might be able to participate in this research to do so. Well, thank you, both of you guys.
Thank you.
Thank you.